Hi everyone, my name is Castro,
And my name is Raghav.
and we're going to do our presentation on the avian Bornavirus. So I'm going to start by talking about Bornaviruses in general and its characteristics. Its viral morphology is that it's an enveloped, non-segmented virus. It's a negative sense, single-stranded RNA with 8,900 bases. Its replication and transcription occurs in the nucleic of nerve cells. In terms of its physiological response, its viral particles are not correlated with the severity of the symptoms, and it is mainly seen in CD3 positive host T cells in the brain. And it is supported by the fact that there are a lot of viral particles. In terms of signs and symptoms of mammalian Bornavirus, some of those examples include head tilting, paralysis, and difficulty swallowing and chewing. On the right, we have an electron microscope picture of the virus, and now we have a cartoon version of the virus. Now I'm going to talk about the avian Bornavirus specifically. It is found worldwide. Its prevalence is higher among captive birds, and 10 to 45% of birds are carriers of the disease. And it has an incubation period between 20 and 200 days. In case you forgot, the incubation period is the time between when the bird got the virus to when the bird started showing signs of it. Some detection methods can be done through the feces, brain tissues, PCR, and the blood serum antibody test. Now, avian Bornavirus can lead to PDD, also known as proventricular dilation disease, and some signs and some symptoms of that include weight loss, dysphagia, which is difficulty swallowing, and regurgitation. In terms of PDD, that is the swelling of the GI tract, mainly in the stomach, and it caused by decreased activity of the GI nerves. And then some signs and symptoms of avian glomerulonephritis include heart disease, neurological conditions, feathering and picking and mutilation, and then behavioral changes. And unfortunately, there is a very high mortality rate for this virus.
Thank you so much for that, Castro. That was a very fantastic explanation of the virus as a whole. Now we'll start looking at some radiographs of the avian patients infected with the virus. This first one, of course, is a healthy avian patient. Unfortunately, it does look like this one has swallowed a couple of foreign bodies in that gizzard there and a slightly inflamed spleen, but otherwise, overall, this is a very normal occurrence of the internal organs of an avian patient. This is a highlighted representation of some of the major organs. Unfortunately, they aren't listed in order of occurrence, especially in the digestive organs, but we'll work with what we've got. So number one, we've got the lungs, 2, the heart, 3, the liver, 4, the ventriculus, otherwise known as the gizzard, which is mainly responsible for mechanical digestion of food. Number 5, the intestinal loops. Number 6 is the proventriculus, otherwise known as the stomach of the bird, which is responsible more for chemical digestion and digestive secretions. Keep an eye on this one. This one's going to be important in a second. Number 7, of course, we have the spleen. Number 8, the kidneys. And number 9 are the gonads of the bird. And in this case, it looks like those are ovaries. So this is a female. And the following radiograph image is of an avian patient with avian Bornavirus. Now, remember how I mentioned to keep an eye on the proventriculus? That large dilation there is the proventriculus. That previous image, of course, had a very smooth, normal, healthy-looking tubular proventriculus. That is quite the dilation. This is a very severe case of avian Bornavirus here. Moving on, some treatments. Unfortunately, research has shown that nonsteroidal anti-inflammatory pain medications such as Robenoxib under the brand name Onsior and Celoxib under the brand name Celebrex are very helpful in mitigating symptoms. However, unfortunately, there is no actual cure for the virus itself. Now, veterinarians do have recommendations for captive birds. Firstly, test them as quickly as you can. for avian bornavirus. If they're positive, monitor for signs and symptoms and limit the exposure to other birds in order to keep to prevent infection of those other birds. If negative, good. Keep them separated from untested birds or birds who have tested positive for avian bornavirus in the past, just to prevent them from getting infected. And of course, these are the sources we used in our presentation. We greatly appreciate you taking the time to listen to our presentation on avian bornavirus. Hopefully you are now much more well-informed on the subject matter. Thank you so much.